Total hip replacement is performed in end-stage arthritis of the hip. Arthritis of the hip is due to many causes. The most important causes are primary and secondary. Some of the most important common causes of secondary arthritis are avascular necrosis of the hip, infections, and post-traumatic arthritis of the hip. Total hip replacement is performed using various approaches. The most commonly used approaches are anterolateral approach, lateral approach, posterolateral approach, and posterior approach. There is no major significance of one approach over the other. It is purely surgeon dependent and based on the surgeon's experience, preference, and expertise in performing the surgery. Complications pertaining to total hip replacement are dislocations, infections, periprosthetic fractures, and implant failure. The most dreaded complication of total hip replacement is a condition called deep vein thrombosis, which usually occurs immediate post-op. The complications post-total hip replacement can be avoided with meticulous planning, proper execution, and good post-operative rehab. The surgery takes about 1.5 hours to 2 hours to perform depending on the complexity and severity of the disease. Recovery post-total hip replacement is fairly good. Patient is made to walk within 24 hours post-surgery. Patient is also advised and encouraged to bear full weight on the operated leg.